So I'm here with Ged Sumner, the director of Body Intelligence CranioSacral Therapy. So Ged, you've got a teacher training coming up here in Chicago for the Biodynamic CranioSacral Therapy work. I'm interested in hearing from you. What is craniosacral therapy?
I think it's probably better to say what is biodynamic craniosacral therapy, because really that's what's on offer, and I think it's quite unique in its spin on craniosacral therapy. So how to say it? I mean, put it in a nutshell, the biodynamic approach to this work is really exploring touch and presence, and how being in an embodied state and offering a contact that is holistic, and that you are literally listening to the body without intention. So there's a kind of non-action, there's a non-doing in the touch. That's what's getting explored in biodynamic craniosacral therapy, which really, I think, generates a totally unique approach to healing that I haven't really come across in this way at all. And it's exciting because there's an evolving healing science that's going on within this field that's probably been around in various forms for about 20 years. And it's kind of starting to mature into, you know, what was probably originally some concepts and some ways into the body that were different, but now it's really finding its feet, actually.
For an everyday person that has never heard of craniosacral therapy, and I would say, and maybe, you know, tell me if you agree, but the word craniosacral therapy really generates no starting place for people to have anything to latch on to. So there is this sense within me of someone that has no background at all in the work and has no reference point. Would you relate it to something that maybe people are familiar with, like acupuncture, Chinese medicine, Feldenkrais, Pilates? You know, what I'm noticing that there is a healing approach to it, and there seems to be almost even a medical approach to it with the anatomy. How would you break craniosacral therapy down into a way that seems what it is separate and unique and different than any other healing modality?
I mean, the name, you know, what's in a name? I mean, what does chiropractic mean, or osteopathy? You know, the names are kind of strange things on the, you know, craniosacral means head tail therapy. So, you know, the name never quite has it really. And it's not just about the cranium and the sacrum. It's become, you know, much more about a whole body contact therapy. So it's come out of osteopathy. I think that's reasonable to say. And in the sort of mid-80s, it started to become separate from osteopathy. So there's cranial osteopaths and there's craniosacral therapists who aren't osteopaths. And the two fields have kind of, you know, moved along in their own ways, sort of side by side, but kind of separate as well. I think what separates the two, probably it's fair to say, is craniosacral therapists don't adjust the body, and osteopaths do, meaning they would use some force to manipulate something, a joint or whatever it is, and they're interested in alignment. You know, but then within the craniosacral field, there's a whole spectrum of different approaches. I think there's a set of therapists who you could say work more directly or more mechanically. So they would use a touch, but they would use a little bit of force with it. So maybe they would traction the body or take the body into rotation or derotation. And then there's a whole series of different interventions which get subtler and subtler. And I would say overall, craniosacral therapy is a light touch therapy. It's not a manipulative science. It didn't really start off like that. And so I think for members of the public, it's about coming along, lying on a table. You don't take your clothes off. It's not a massage. It's not a manipulation. It's the experience is somebody holding part of your body, and they're quite still. So as a therapist, let's say I just hold somebody's head like this, and you start to learn how to tune in to the physiology of the body and to, have a very sensitive, deft touch that allows you to listen with a lot of depth. And the biodynamic approach is interested in just doing that, literally listening to the body and listening to the health in the body. And what it says is when you do that in a skilled manner, there is an automatic response from the body's own intelligence, and we call it the inherent treatment plan. So the body then starts to reorganize itself, believe it or not. I think that's the big thing about this biodynamic approach to the work. So that takes quite a lot of training. It means that the therapist needs to be highly sensitive to bodies, including their own body. And the training's gone from being sort of short and a postgraduate training in the beginning now to being sort of undergraduate and a couple of years. And there's this kind of maturation process and self-development process that enables you as the student to really become more embodied. And I think what we're offering is embodied presence through a knowing touch. And by a knowing touch, I mean how the details of how the body feels. So you can generate a tremendous sensitivity through your touch that allows you to recognize all the different elements of the body, like bones or the fascias or the organs, the nervous system. And because of that, you can discriminate what the body is revealing to you in a session through sensate awareness. That's what we're doing, really. Rather than going to a body and maybe motion testing or trying to figure out what's happening in the body or looking at the body in terms of alignment. There's all these different methodologies to work out what's happening, but we're doing it purely through being receptive via touch. And I think in that way, you are into quite a different landscape of healing that becomes very fascinating, because actually the so-called healer, me, as the practitioner, isn't so much a healer anymore. It's more about, or a fixer of the body. It's more about being present to the power of health, actually. And that by itself starts to generate an internal response. So my experience of being a therapist is a little bit like watching a movie. And the movie is the client's physiological wisdom coming through and shifting and changing itself. So bodies can adjust themselves. That's the big thing in this approach. And he doesn't need a therapist to come along and go, let's do this with your knee. Well, let's do that with your knee very, very subtly. In a way, we've let go of all intention. And we're just sitting back and giving the body a really good chance to roll it out. And that's what it does. It's really great at that.
In my research of kind of looking into what is craniosacral therapy, one thing that I walked away, Ged, with was the sort of emphasis and focal point on the cerebral spinal fluid that flows from the base of the pelvis through the center of the spine up into the skull, traveling through around the membrane underneath the skull back down. and again, this is from watching some YouTube videos and doing some Google searching, that there seemed to be an ocean current, that the cerebral spinal fluid flows, and it flows in different waves. Some of them are faster or longer durations, some of them are slower durations. I'm interested to hear from you. Is the cerebral spinal fluid, would you label that as sort of the core foundation of craniosacral therapy? Is that the deepest part of what we're looking for as a therapist with our client on the table? Or is that just a minor component of many things that a craniosacral therapist does?
I think that's part of what I call the classic work that Sutherland generated, and that's kind of followed by probably most mechanically oriented craniosacral therapies. Biodynamically, I think cerebral spinal fluid has got less and less pivotal as the therapy has matured and sort of flourished. I mean, there's something remarkable about the therapy in terms of an understanding of the body as a fluid entity. I think that's one of the big offerings in craniosacral therapy, that we are fluid bodies. And there's also an understanding that we have a center line, or midline as it's often called, that is essentially fluid. So embryologically, if you look at how the body forms itself, the first thing to emerge that is still part of us is the neural tube. And then there's a development out from the neural tube that generates, bones and limbs, the whole tissue field, really. So the very epicenter of this physiology is a fluid space that has not changed since we were neural tubes 24 days after conception. So the biodynamic approach gets very interested in that and says that, look, there's the tremendous health in those deep fluid spaces in the body that comes through in lots of different ways. I mean, one of those ways is what Sutherland called primary respiration. So this kind of life force, deep breathing that's going on in the body that's not to do with the lungs. It's to do with, I guess, the whole tissue fluid field being in this kind of subtle motion of life, which, as you say, is a bit like an ocean. We call it the tide. And biodynamically, we're interested in a number of different tides, quite a few of them actually. So there are, let's say, traditionally there's a fast tide, which is running at something quite similar to lung breathing. It's about the same actually. But the body can drop into different gears, and that primary respiration can slow right down to 24-second cycles, 100-second cycles, or even longer than that. So all this has been sort of mapped over time by various practitioners. And therapeutically, that's just incredibly profound. So when your body is able to drop into a state that shows these slower primary respirations, there's a tremendous reordering that goes on in the body from the sort of bottom up.
Who would seek craniosacral therapy as a client? Would you say the majority of people that are seeking craniosacral therapy are seeking physical relief from some injury or headaches or bodily sensation that's not working? Or would you say that it's also possible or more predominant that people are seeking craniosacral therapy for awareness awakening within their life?
I'm going to answer that in a slightly roundabout way, because what I think is important to understand about this approach is, if you touch somebody with what we call a neutral listening, i.e. we're not bring in an intention to the body, and we're in a state of balanced awareness towards them, and we're being receptive, and we're also opening up to the feeling and power of health within them. And we are also interested in how the touch can be holistic, i.e., how we can listen to the whole body and not just be local. Something very profound happens. The body goes into an automatic trauma resolution process. It doesn't need to be told to do that or how to do it. And it goes about it in a very organic way. And so people's unresolved shock effects, the unresolved experiences that could be anything ranging from loss of somebody and unresolved grief, right through to a fairly simple thing like falling on the floor and damaging your back or your coccyx. You know, there's a world between those two of pathologies and conditions. Yeah, basically all of those things are trauma events that have not been processed by the body for one reason or another, and the body has got a natural ability to resolve those and to clarify or move through them, and that's exactly what takes place with this touch. It's automatic. So the client system therefore starts to change around all kinds of conditions and pathologies. It doesn't matter what the condition or pathology is. Underneath that is what's trying to heal and move.
I'm also interested in hearing from you around the word biodynamic in terms of craniosacral therapy. Like anything in life, there are multiple paths to the goal or the desired outcome. And from someone, again, that has no background of craniosacral therapy, and it's a foreign term, it's coming at me for the first time, the word biodynamic really doesn't mean anything to me. I'm not really interested in knowing why that's an important term to the craniosacral work. I'm more interested in craniosacral therapy upon first glance. But I would like for you to speak to those people that either have gone through the door of learning more about craniosacral therapy, or they are interested in going into the work a little bit more in depth, and how the biodynamic approach offers a slightly or completely different approach than, say, other paths of craniosacral therapy.
Sure. You know, what's different about the biodynamic approach to other craniosacral approaches? It's a longer training. It's much more in-depth and thorough. And obviously you can take craniosacral courses in a long weekend, or you can come on this training and spend 2 years learning how to do it. I mean, there's levels of skill in this biodynamic approach that need time to emerge. And to practice this approach needs a tremendous embodiment from the practitioner's point of view, and an ability to be in a deep connection, a knowing relationship with their own physiology. That is not a small thing. So there's a very powerful self-development process occurs in the program. And somebody who can arrive at that, who then touches you, is touching you with a tremendous power. Yeah, you would know the difference. Bodies like that. They like embodied bodies touching them. And then all the skills that we are learning to listen with detail to the client's body is a power as well. So there's a lot more depth to this training, and I think there's a big interest in learning to relate to health. That is a massive process. So touching somebody and not going, what's wrong here, what needs to be sorted out, what needs to be fixed. So touching somebody and going, what's okay here? Let's listen to the life force that's binding this body together. Because actually, even if you're riddled with cancer, I would say you're still mostly healthy. Health is still brimming in your system. So that's a different paradigm, never mind a different skill. And then to sit back and let the body generate its own organic, automatic responses, and then to go through a trauma resolution process, it needs a practitioner that is knowing, savvy, understands the nature of health and trauma, and can generate a safety for the client. And I think that's become really paramount, that the practitioner there is not somebody who's just done this in a weekend and has a touch that is, doing something, but really understands the process of healing. And we call it this coming into contact with another individual, establishing a relational field. So you can kind of hear from that phrase that it's gone beyond just doing a touch and adjustment process. It's way, way beyond that. It's something to do with the flux and the sort of presence of between two bodies. That's what's getting explored here. So people come to this therapy, I think, when they probably want something deep, something that can really go underneath lots of conditions that they might have had for a long time. And also somebody who wants something supple and not to be, manipulated in some strong or powerful way. So I think there's a movement towards the subtle that's going on generally. And this biodynamic approach really fits that bill. It's really exploring it in depth.
So I'm now interested, Ged, in hearing from you in relation to biodynamic craniosacral therapy. It seems that there is a brotherhood or a sisterhood, a connection to mindfulness. Maybe you might say meditation, or I would even venture to say Reiki could be potentially relatable to the mindfulness dropping part of the experience of being with the client's body. Could you speak to the teacher training program and what students would learn as far as, and how they would learn as far as dropping their ability to listen on a deeper level to what's happening on the table?
Lots of people come into this training from all kinds of backgrounds. It's an undergraduate program. So typically people come in who are clients of this work and have experienced it, other kinds of body therapists, and people from movement backgrounds and people from meditation backgrounds, people who've got into spiritual practices, etc. So it's quite an amazing mix of people. And I think they're all coming together to explore the subtle and to, as you say, to deepen, drop into the systems in a more profound way. So the course does deliver on that. I mean, that's its power, I think. So it's a layered, a gradual learning process that is both conscious and unconscious. It's mostly unconscious, actually. I mean, what we're trying to change is the unconscious within the physiology. So what you're holding unwittingly, or what you're repressing in a way, and perhaps that's not so something that you know about. So as the course unfolds and the learning takes place, the body starts to let go of all kinds of posturings and all kinds of programming and sort of mental, emotional constructs. And that's exciting because I think it takes the body into this sort of natural state of original health. You know, you go back to being a baby. I mean, that's all we are anyway. We're just big babies, and you really go back to that state, and that's beautiful because your mind goes very still. The practice of this work is about non-thinking and non-doing. I mean, you couldn't get more meditational than those two things. Plus, you're actually sat there very still for long periods of time. So you tend to make about 2 or 3 holds in a craniosacral session, which might last 35 minutes or maybe 40. So the body's, you know, very still. And also, one of the big things in this work is stillness. So it's something that emerges in the client's system. And basically, the body just goes very, very still at lots of different levels. And we talk a lot about stillness, and particularly about something called dynamic stillness, which is this notion of a state of being within the human system that's like an ultimate state. It's behind all movement, all physiology, all primary respiration, etc. So yeah, that's very attractive to a lot of people who are seeking a meditational aspect to healing.
What is your vision with this work, and why are you wanting to bring more teacher trainings and this work to the world?
I think this work is a consciousness changing therapy. I mean, of course, people's bodies make all kinds of shifts, but the remarkable thing that you observe as a practitioner in this field is watching people change their behavior radically often, and just take quite different directions in life, kind of find out who they are or what they really want to be doing in life on this planet. And it changes people so they become more sensitive to themselves and therefore others. I mean, that's got to be a great thing to promote. And obviously the world is, I don't know, having a bit of a meltdown, I think. You know, I observe people's bodies are struggling just to get by on a day-to-day basis. So there's such an amazing reset with this therapy. It deeply understands hyperarousal. It understands the way the body can get super stressed and how to help it, and how bodies can contract and close down and go into that kind of cycle as well. And I guess a depression cycle. It can really deeply help with those things, you know. And I'm doing it because I'd like to see the world change to a much wiser place to live in, a more civilized place to live in. And you know, I think it's potentially achievable. So if there's enough therapists out there who are touching enough people, the sort of knock-on effect has got to make some kind of difference. And I guess it's my contribution to, you know, the world.
The last question I want to ask you, Ged, is about the teacher training process. And if I'm interested in taking the teacher training process, what am I going to experience, not only in what you're teaching, intellectually, intuitively, energetically, but what's the experience going to be with my peers? In your experience of offering this teacher training now a number of times around the world, what do you notice with the other students and their interactivity and their practicing together on one another? What is your observation of that process?
Well, excitement. I think people quite quickly recognize there's something very profound about this work in the first seminar. So people come on this training and just take the first seminar as a standalone and then experience it, and then make the mind up if they want to commit to the whole program. And yeah, I mean, you all go through a very deep process of change. You know, there's a tremendous interaction. the nature of the work is it's relational. And the nature of the work is that it's not dogmatic. I actually really like that. That's why I'm kind of particularly doing it. So it's there is a paradigm, but for me, you can throw the paradigm out if it's not matching with observable processes in a clinical setting. And I think everything's up for debate and discussion, and that's how the program is run. You know, it's not like there's somebody up here who's a pedagogue and laying down some sort of absolute ideas about things. Not at all. It's like, I mean, in a way, it's like, what's life? That's the query. I mean, that's the course in a way. Actually, what is life? Let's see if we can feel life by touching. And let's talk about all kinds of ideas that have been generated in the field, which are very interesting, but let's not believe them. Don't believe anything. Just let's see what will happen if you just sit and touch somebody and let go of intention. I think that's the crux of it. And very exciting things happen. You know, people with very strong conditions like Parkinson's, MS, I mean, these are really powerful pathologies respond. You know, that's what we're finding. People are responding to this touch, and their conditions are improving. So that's exciting for students. They go away after the first seminar and put their hands on people. We say, actually, put your hands on healthy people for the first year, so you can just get used to health, and then put your hands on obviously unwell people for the second part of the course, you know. And students touching people, those people respond often really well. And so there's a debate that goes, what are we doing here? What is it? What is this touch? How does it work? And honestly, I'm not entirely sure. You know, what is the power of presence? Why does that bring about such deep, profound change? I mean, I think it's the mystery of life as well, you know. But I think the classes are great. There's tremendous debate and sharing of experiences. Obviously, there's a lot of table work where students pair up and tutors come around and all of those things. And I just think that is a very rich learning environment, and everybody develops in a very wonderful way.